Hi, welcome back to my channel. My name is Dr. Nihir Sinam and I'm a plastic surgeon practicing in Imphal in Manipur. So in this video, let's take a look at how a mole removal is done. So a mole can be of different sizes, shapes or appearance. It can be flat, it can be raised, it can be tiny like a millimeter or two, or it could be about 7 to 8 millimeters also. It can be flat and raised. The colors may vary. It may be brownish or quite black in color. So there are different types of moles, but people sometimes get concerned if they can have some health risks like development of a cancer in those moles, or if that mole is a cancer itself. So whenever someone has a mole, quite a few people like to get it removed for cosmetic purposes because they don't like that mole being on the face or other parts of the body, or they are concerned about the health risk, as I mentioned. Every mole does not have to have these risks. Only a very small percentage turns out to be a cancer or something that's developing into something like a cancer. So if you have a mole from a very long time and its shape and size is the same and there's nothing going on over there, it's okay, nothing to worry about. But if the size is rapidly increasing, the shape is changing, the color is changing, then it is always better to go to a healthcare professional like a plastic surgeon or a dermatologist to get it evaluated for the possibility of the health risks, as I mentioned, just to get it checked out. So, there are various ways of getting a mole removed. The two most common ways of removing a mole that I do are: first is a surgical excision. So, if a mole is superficial on the superficial part of the skin, or if it is slightly deep, we could do a excision. We could remove the mole with a surgical blade with a small margin of a couple of millimeters, and then we'll close that wound with sutures. The other method is removal with a electrocautery, that is a radio frequency cautery. We can burn and destroy that cells or the tissue with the radio frequency electrocautery. So that can be used for very superficial moles. We don't want to use radio frequency electrocautery for deeper moles, because if we burn and damage the tissue quite deep and leave it like that without any surgical closure, then that might lead to a scar that does not look very good. So we have surgical excision and removal by radio frequency electrocautery. We have other techniques like shaving with a surgical blade, or we could use lasers, but those are less commonly done, and the two that I mentioned are the more commonly done procedures. So, how long does it take? It takes only a few minutes. It might take about 5 minutes or 10 minutes, and it is a minor procedure, of course. Of all the procedures that I perform, I think mole removal is the simplest and the easiest, quickest procedure performed. Even though I'm saying that it's easy and quick and a very minor procedure, someone with a lot of experience needs to do it for you to have a precise removal so that you don't have much scarring, and for that assessment of which technique will be best for your mole so that you have the best healing and 99% invisible scar. So in order to perform the procedure, a local anesthetic injection, which is a very safe injection, in most instances, and even if you get that injection at a couple of places on your face or body, it's okay. If you get the injection a couple of times, a few times in your life repeatedly for various procedures, it's safe. Unless you're having an allergy or an instant side effect, it's safe to get it multiple times. A lot of people ask me about it. So we give that inject local anesthesia at the side of the mole, and that particular part of your body gets numb, and then the surgical removal or the radio frequency cautery removal is done. And then after the procedure, if stitches have been applied, and those need to be removed after a few days, and some instructions will be given for proper healing and some advice like avoiding sunlight, avoiding picking on the scab, and to let it heal properly, an application of an ointment. And you don't need much medications for mole removal. Some doctors may prescribe an antibiotic, but it is not necessary most of the time, and you could be prescribed with a painkiller to avoid some post-operative pain, which is not much in most of the people, and a lot of people don't take even a single tablet because they don't feel any pain. I sometimes give some other medications which will help in very good healing to avoid swelling of that part where the mole was removed, and some other supplements to help have a good healing and less scarring. The advantage of surgical removal is that if the doctor plans on sending that mole which has been removed for examination to a pathologist, it is possible. But if you're destroying that tissue with an electrocautery, then it is not possible to send that specimen of tissue for the biopsy if it is suspected to be not a mole and something else. Thanks a lot for watching this video. If you have any queries or comments, please put it in the comment section. If there's any other topic that you would like me to speak about, let me know. Thanks a lot for watching. See you in the next one.